So one of the questions that you're going to have on your mind now and especially down the road is, am I successful? Did I accomplish everything that I wanted to? And I'll often have patients ask me, what is your success rate with bariatric surgery? You first have to define what success means, and it's a fluid definition, and it can be different for everybody, and that's okay. The standard bariatric surgery definition would be that you lose at least 50% of your excess body weight and that you keep it off for either 2 or 5 years. The most rigorous definition would be 5 years. I just have a hard time using this because not enough patients follow up for 5 years to adequately judge this. And so I think it's a difficult number to know. So in my practice, I like to use 50% of your excess body weight loss and keep it off for at least 2 years. And if I use that definition, we have about a 75% success rate. However, I don't really think that that's the greatest way to define success, because I have patients that lose 40% of their excess body weight and they're extremely happy. And I have patients that lose 70% of their excess body weight and they're not happy. So patient satisfaction needs to be brought into the equation for sure. And success is also not really about the number on the scale. I think that the people that lose 40% and are happy tend to be those who have changed their lifestyle. They've gone from being sedentary to being active. They get involved in things that they couldn't do before. Maybe they start dancing, maybe they start hiking, and that makes a huge difference in their life. Or maybe you had type 2 diabetes prior to surgery and you don't have it anymore. You don't have to take any medications. I don't believe that you're ever completely cured of type 2 diabetes. I prefer to call it a remission. But gosh, if you are on medication and you get off of it, that's really, really rewarding, and that's improvement in your quality of life. Sometimes, as we have talked about in other parts of this video, sometimes it's just improvement in your relationships. You're more vibrant, you're more loving, you're more giving, and that's hard to put a number on. So there's a lot of different ways to define success. So what I would urge you is, it's okay to have a numerical goal. It's okay to look for a certain number on the scale, but please don't get too tied into it and let it be the end-all be-all of how you judge success or failure. And really, I kind of hate using those black and white terms because that just doesn't really apply. We're trying to achieve the highest quality of life that we possibly can. We're trying to make your life everything that you want it to be and that it can be. And so really, it's always a journey. We're never going to get to an end point. But if that journey becomes more enjoyable and more active and more loving and has less medications required, then that's successful. So be careful about getting tied into the number on the scale or getting tied into a black or white assessment of how you've done with your operation.